Hello, this is Dr. Anna Chesnakova, and today I wanted to discuss symptoms of SIBO. SIBO stands for small intestinal bacterial overgrowth. And why I wanted to discuss this with you, it's basically for my clients, for them to have better understanding of their conditions, and also to explain why we are doing certain things and why they were recommended certain supplements. And also for people who are having conditions like irritable bowel syndrome, inflammatory bowel disease such as Crohn or ulcerative colitis, for people with fibromyalgia, for people with chronic fatigue. It will also might be related to people with liver conditions such as non-alcoholic fatty liver, for example. It can be related to people with skin issues like scleroderma, acne rosacea. It can be related to gentlemen with prostatitis, also for people who are having interstitial cystitis, for ladies with hormonal imbalances, for every person with autoimmune disease, like rheumatoid arthritis, multiple sclerosis, Hashimoto thyroiditis, psoriasis, to name a few. So basically all of you might have SIBO as a contributing factor to your symptoms. So what is a SIBO? So we have this diagram of gastrointestinal tract, and it starts from the oral cavity and ends with the back passage, and on all of the portions, all of the parts of this digestive tract, there is a certain acidity or alkalinity level measured in pH and certain amount of bacteria present. And the maximum amount of bacteria is usually present either in oral cavity and in the large intestine. Small intestine is the main part where digestion occurs. So this is where we digest our food and where we get all the nutrients, vitamins and minerals from our food. And therefore this part, which is like a small intestine, or better seen on this diagram, so this is a small intestine. Therefore the amount of bacteria should be kept at a minimum in order for us to digest this food properly. And what is happening in SIBO, the amount of bacteria is exceeding 10 in power of 3. So it's not necessarily pathogenic bacteria, and as we know, there are non-pathogenic bacteria which is not causing disease, and there can be even beneficial bacteria in our guts which help us to digest food, to produce vitamins for us, to protect us from pathogenic bacteria. There can be potentially pathogenic bacteria which sometimes can lead to a disease in certain conditions, and there is pathogenic bacteria. So in small intestinal overgrowth, usually it is overgrowth of non-pathogenic bacteria, when this bacteria presents in larger counts than normally. And what are the symptoms of small intestinal bacterial overgrowth? These bacteria digest fiber in our intestines, fiber which they get from our food, and they create gases. They can create hydrogen, they can create methane, they can create hydrogen sulfide. And all the symptoms are related to this process. So these are mechanical symptoms. When there is too much gas created, it can lead to bloating, and this is the main symptoms of SIBO. If the bloating is excessive, it can lead to abdominal pain or abdominal cramps. Other symptoms related to the toxic effect of such gases, because, for example, hydrogen sulfide is a very toxic gas, and it can get absorbed to our bloodstream and get distributed all over the body, and it affects every organ, including brain, creating brain fog, problems with the short-term memory, problems with the mood. It can also lead to the itchiness, to the hives. Some clients report that they might develop itchy eyes after certain foods, and some clients develop fatigue, and some clients even end up bedbound after eating large carbohydrates meal. And because of these processes, bacterial overgrowth can damage our digestive capacities. So in the small intestine, in this part of the digestive tract, there are two types of enzymes. One type of enzymes is secreted by the pancreatic gland, and the other class of enzymes secreted by the enteric cells themselves. They called brush border enzymes. And if you look microscopically onto the small intestine, we can see these small microvilli, and they're usually nice, plump and high, and their role is to increase the surface of our digestive tract, because this bacterial overgrowth, it leads to the flattening of these villi, so they become more flattened. This reduces the surface of the digestive tract, and therefore it reduces the amount of vitamins and minerals and macronutrients we get from our food. So this can result in malabsorption, and consequently it can result in the symptoms of nutritional deficiencies. So for example, because bacteria is utilizing calcium, magnesium, iron for their own needs, it can lead to those deficiencies. It can result in hair falling or dull hair, or brittle nails or brittle bones. In some cases it results even in low hemoglobin. So I've got a client who is meat eater, yet she has got hemoglobin on the lower side and her ferritin is on lower side. And it can be even worse in the clients who wants to become vegetarian. So if they have got this bacterial overgrowth, they can develop, they can become anemic, because the bacteria is stealing nutrients from them and preventing them from absorbing those nutrients. So these are the symptoms of SIBO.